Vaccination efforts are moving forward in Rhode Island. Those leading its distribution locally admit it may be going slower than you expected.
12 News reporter Brandon Truitt working the latest for us from the Department of Health. And Brandon, you have some new reporting today on the timeline of nursing home vaccinations and what happens with any unused doses.
Yeah, Brandon, Kim, as we have been reporting, the state is in a contract with CVS and Walgreens to help with the distribution efforts. So we know a certain amount of doses are allotted to them each week. Today we learned when they are done making those rounds at nursing homes and congregate care facilities, what is not used is freed up for the state to take.
Tonight, Rhode Island well into phase 1 of vaccination. Nursing homes highly prioritized early on. The state partnering with CVS and Walgreens to handle distribution there.
This week will be the halfway mark.
The contract with the pharmacies requires 3 visits to each nursing home, each visit spaced 3 weeks apart.
So at the second clinic, which started last week for nursing homes, people who didn't get first doses at the first clinic were eligible, as well as folks who were ready to get their second doses.
That same process is happening at group homes now, too. At the end of each round, there's a chance for unused doses.
If they have extra, what happens with that?
What CDC opened to us recently was the opportunity to now defer vaccine.
Extra doses go back to the state, used how they see fit.
Based on the number of people who we anticipate will get vaccinated over the course of the next 2 weeks, we can look at the allocation that's going to CVS and Walgreens and pull either some of that vaccine or all of it out of their allocation and into the pot of vaccine we're able to draw from directly.
The state could not give an exact number or where they would go, but expects a clearer answer in the coming weeks. As we've reported, roughly 40% of the vaccine the state has on hand is on standby, part of it allotted to the pharmacies. The state says what would help create a faster flow is an increase in the weekly vaccine delivered.
We are ready to go. We want everyone in Rhode Island to get the vaccine and at least have access to the vaccine. So we're getting there. Again, patience is sort of the key to this process.
So this comes as there are reports out that states who have chose the CVS Walgreens partnership are moving slower with distribution than those who did not. Rhode Island health leaders today telling me they are not looking into that. They continue to monitor the distribution efforts. And guys, so far they're saying everything is moving at the rate that they have expected.
And Brandon, as phase 1 continues, you're also learning now the state will announce phase 2 designations this week.
Yeah, that's going to be a blockbuster briefing there on Thursday, as there has been so much said over who should be included in phase 2 and whether or not teachers are going to make the cut. Have you landed on where teachers will go yet?
So we've received input from all sorts of sources, including our Rhode Island Vaccine Subcommittee, and we'll release some further details on Thursday for sure.
So a little bit of a non-answer there from Dr. Chan, but he did point out that once this is announced on Thursday, phase 2 designations are going to be up to be adjusted as that process moves forward, guys.
Thursday will be a big one. Brandon, in a snowy Providence today, our thanks to you.